Good evening, guys. Keep your dreams alive. To achieve anything, you must have self-belief and faith in ourselves, and hard work, determination, and dedications. This is Dr. Mohan Babu, your physiology educator in Medicoz Community Platform. Medicoz Community Platform will help you to fulfill your dreams because it's a perfect online educational tool which includes various live interactive sessions with expert faculties, and it offers various question banks, test series, and e-notes by expert faculties, and all the test series and question banks are based upon the latest syllabus. Okay, and Medicoz community website, we have an early bird offer is live now for the National Exit Test 2024. Hurry up, guys, and try to book this slot because the slot is the offer is first 3,000 members, and get huge premium discount on all available plans of the Medicoz community. Today we are going to discuss 25 most important clinical based MCQ physiology MCQs in 2 schedules. Today we will see 12 MCQs, and February 23rd we will see the next 13 MCQs, and these MCQs are for 2023 NEET exam preparation aspirants. Am I audible? Shall we proceed? Moving to the first MCQ of the today. The medical student is conducting an experiment related to body fluids. Which of the following substance is most likely to be helpful to measure the volume of intracellular body fluids? Okay, the options: A, Evans blue; option B, heavy water and mannitol; option 3, mannitol and Evans blue; option D, radioiodine labeled serum albumin and mannitol. Can you guess the answer for this question? Right, guys. Before going to the options, we will see first few facts regarding the body fluids. Our total body water is distributed into 2 compartments: intracellular fluid compartment and extracellular fluid compartment, and this extracellular fluid compartment is again divided into interstitial fluid compartment and plasma. Okay, if we want to quantify these fluids according to the human body weight, this total body water accounts for about 60%, while this IC of intracellular fluid compartment accounts for about 40% and extracellular fluid compartment accounts for about 20%. You could easily remember as TI. This is for total body water, intracellular fluid, and this is for extracellular fluid compartment, and the rule is 60, 40 and 20 rule. Okay, you could easily remember it as TI 60, 40, 20 ratios. Okay, and then next, this extracellular fluid compartment 20% is divided into 15% intracellular fluid compartment and 5% in plasma. Okay, we could also able to derive or classify these body fluid compartments in a different way, like this: the 2/3 of the total body water is your ICF, 1/3 of your total body water is your ECF. We can again divide it into with these ratios. We can either express this intracellular fluid with respect to ECF or with respect to total body water. If I express this in terms of extracellular fluid compartment, this is about 3/4 of ECF and 1/4 of total body water, and this is about 1/4 of extracellular fluid and 1/12 of total body waters. Okay. In order to measure these fluid compartments, we need to use markers. Okay. If we use this marker in this compartment, the property of this marker is that it should evenly distribute in the compartment what we are measuring, and this marker should not metabolize. They should evenly distribute and should not metabolize. So, after a certain period of time, once the marker gets equilibrated inside the compartment, we can measure this fluid volume by the formula, the amount of the marker what we inject into the compartment upon final concentration achieved after reaching the equilibrium. Using this formula, we can able to calculate this various fluid compartments. Okay. But there is an exception. The fluid compartment, the letters starting with letter I, that is your ICF, and interstitial fluid. Intracellular fluid compartment and interstitial fluid compartment, that cannot be measured using the markers directly. Okay. So, with the help of the markers available to measure other fluid compartments, we can able to measure these two fluid compartments, interstitial fluid volume and then interstitial fluids indirectly. Okay. So, going to this table for the available markers to measure these individual fluid compartments. Here we, in order to measure this total body water, we have deuterium oxide. Deuterium oxide is also called as heavy water, and we have tritiated water, and apart from that we have antipyrine to measure the total body water. And in order to measure extracellular fluid compartment, we have these markers available: mannitol, inulin and sulfate. Sulfate will be radio labeled with sodium. Okay. Among the markers available to measure the extracellular fluid compartment, the best marker available is inulin. Inulin is the best to measure the extracellular fluid. This is another MCQ, it can be asked. Okay, best marker to measure the extracellular fluid compartment. And coming to the ICF, we know that ICF cannot be measured directly, we do not have any markers. So, it can be measured indirectly using the formula total body water minus extracellular fluid. So, we just now see that markers available to measure total body water and markers available to measure extracellular fluid. So, with the help of these markers, we first initially find the total body water separately and extracellular fluid volume separately. Then upon subtracting these two volumes, we will get the intracellular fluid volumes. Okay. And we have the markers available to measure plasma. We could easily remember it as, whenever we say the word plasma, the next word we will remember it is proteins, right? Plasma proteins. The major proteins, plasma proteins is your albumin. So, this albumin will be radio labeled and we can use to measure this plasma. And apart from that, we have Evans blue. Okay. Then coming to the interstitial fluid compartment, as we know that interstitial fluid cannot be measured directly, it can be measured indirectly using the formula extracellular fluid compartment minus plasma. Okay. Coming to the question again, now tell me what will be the answers. The answer for this MCQ is option B, that is heavy water and mannitol, because we have seen that the heavy water can be used to measure total body water and this mannitol can be used to measure extracellular fluid volume. So, total body water minus extracellular fluid will give our results intracellular body fluids. Clear? And what about these two other options? Mannitol, Evans blue. Mannitol, you know that this is for extracellular fluid compartment, and Evans blue, this is for plasma. Radio iodine labeled serum albumin, this is for plasma, and mannitol, this is for extracellular fluid. So, these two markers are available to measure interstitial fluids. Okay. So, the answer is nothing but option B, heavy water and mannitol is to measure the intracellular body fluids. Moving to the question number 2. This question is very easy because this is just an extrapolation of the previous one. In the previous slides, we have just seen the formula to calculate the volume of an fluid compartment. The question is to calculate the extracellular fluid volumes, and you have to pay attention to some of the key words in this question. 5 gram mannitol was injected. This is the amount of the dye they have given initially. So, this should go to the numerator according to the formula, and but 40% of them are excreted in urine. So, the whole 5 gram is not remaining in the body to get equilibrated in the compartment. Among that 40% of them are excreted in urine already. So, only the available mannitol will be getting equilibrated in the compartments. Okay. So, you have to be very careful in these lines. After equilibrium, the concentration of mannitol is 30 milligram percentage. Now, try to calculate. The formula is volume is equal to amount by concentration. This is what just we have seen, but from the amount what we have injected initially, some amount of dye is excreted in urine, right? Mannitol is excreted in urine. So, we want to subtract that to get an exact amount of dye in order to get finally equilibrated in the compartment. So, applying this formula, we are converting into milligrams. 5 gram is 5000 milligrams, and 40% of that 5 gram is 2000 milligrams divided by your concentration, which is 30 milligram percentage. I am rewriting as 30 milligram per deciliters. This is milligram. Upon calculation, we will get 3000 divided by 300 deciliter. So, value will be 10 liter. Option C is the answer, 10 liter. Okay. You will definitely find this kind of calculation based questions in your MCQs. Okay. So, you have to use this concept, and you have to always pay attention to these words. Okay. This is kind of repeated MCQs asked in various examinations, NEET examination and INCT. Okay. So, you have to be very careful in that part. Moving on to the next MCQ for the today. Which of the following image illustrate volume status of a person receiving 1 liter of isotonic saline in a medicine ward? Look for the images. First of all, can anyone tell me what is the name of this image? What is the name of this diagram? Name of this diagram is, or the kind of image is, Dannett arrow diagram. Dannett arrow diagram. Okay. Now, guess what could be the answer if a person receives isotonic saline in medicine ward? So, before that, I want to say this Dannett arrow diagram will tell you the volume status as well as osmolarity status of your both ICF and ECF fluid compartments. Okay, this have both x axis and y axis. Sorry, in x axis volume will be plotted, and in y axis osmolarity will be plotted. Okay, we will see this little bit detail. So, just I mentioned, in x axis the volume of this compartment will be explained, and in y axis osmolarity will be explained. Okay. Imagine this is a fluid compartment. This is your extracellular fluid compartment and this is your intracellular fluid compartments. Yes, can you able to follow this? Okay. Now you have to remember that you have to be very clear in mind that whenever a solution we add or whenever any fluid loss occur from our compartment, the fluid loss or the fluid gain will takes place from the extracellular fluid compartment. Okay, if we gain or if it is loss also, the first compartment which will be affected is extracellular fluid compartment. Okay, and after that your ICF volume and osmolarity will change or will change depend upon the what type of fluid you are adding or what type of fluid is getting lost from the extracellular fluid compartment. So the final fluid volume and osmolarity of the ICF will be decided by what type of fluid loss or gain taking place in the ECF. Okay. Now imagine this similarly, this is our ECF and this is our ICF. Okay. For example, if I want to add an isotonic fluid, if I want to add isotonic fluid, if I want to add isotonic fluid here, what will happen to this volume? Definitely the volume which is in the x axis will rise, yes, because we are adding some amount of fluid to the extracellular fluid compartment. So obviously our x axis will expand. Now tell me, what will happen to the osmolarity? Will it change? No, because we are adding only the isotonic fluid, right? So there won't be any change in the osmolarity of the ECF. So the newly adapted volume of the ECF is this much. Okay, clear on this point? Then next step what we have to do, we have to see the what will happen to the change in the ICF. Okay, guys, tell me, will any change occur in the ICF? Why? There is no change will happen because we are adding only isotonic fluid, right? Isotonic means that electrolytes and the water are very equal. So isotonic fluids are we are adding. So and also here also there will be balance exist between ICF and ECF. So there won't any change occur in ICF volume as well as osmolarity. No change occur in ICF if we add an isotonic fluid. Similarly, if there is any loss of isotonic fluid also, only volume change will decrease in the ECF. No other change will happen in ICF as well as osmolarity. Okay. Wait, clear? Get this point? Okay. Now coming to the another one concept, and maybe when we move to the MCQs proper. For example, if I add an hypotonic fluids, for example, in condition called as syndrome of inappropriate and antidiuretic hormone secretions, if there occurs the gain of hypotonic fluids, there occurs gain of hypotonic fluids. Okay, first change will happen in ECF, right? This change, how will it affects? Obviously the x-axis is the volume, definitely it will change. What will happen to the osmolarity? Another question. Will the osmolarity remain same? No chance, because we are not adding isotonic fluids, so there has to be some change. Now the osmolarity has to increase or decrease. Imagine we are adding hypotonic fluid, which is having more fluid, less electrolytes. So the newly adapted volume also will have the osmolarity low, decreased. Now the new osmolarity will adapt to this point. Okay. Okay. Now what will happen to the ICF volume and osmolarity? Imagine now what will happen to the fluids if there is an hypotonic fluid, another there is a compartment. The fluid will go to this side and try to equilibrate with both sides. So our ICF volume also increases in x-axis. Once it is receiving only water from that ECF, its osmolarity also decreases. So ultimately the new state will be occur like this. Okay. So you have to be very clear that what type of fluid you are adding. First change will happen in ECF, the next ICF will change occur according to the whatever the fluid type of fluid you are adding in the ECF. Okay. Okay. What is the option for this question? Answer for this question will be, yes students, you are adding only isotonic saline. So the change will happen only in ECF. So the option is C. Okay. Moving on to the next question. Calculate the tetanizing frequency of the muscle from the given simple muscle twitch recorded from the frog gastrocnemius muscles. We want to calculate the tetanizing frequency, and this is very simple because we know that the formula for tetanizing frequency is nothing but 1 by contraction period in seconds, right? Here we have to find what is the duration of this contraction period. From the graph given here, this is the graph of the simple muscle twitch, contraction followed by relaxation, right? So this period will be your contraction period from the point of this slight rising upstroke to the point of this will be your contraction period. What is this? The contraction period is 25, duration is 25 milliseconds, right? If you apply the formula here, if I want to convert into milliseconds, 1000 divided by contraction period, what is here? 25. Simple calculation, the frequency will be 40 Hz. So the option is C, 40 Hz. Okay. Moving on to the next MCQ. All are features of slow twitch skeletal muscle except they are asking for the features of slow twitch skeletal muscle, except we have to find for the exceptional, that is except options, odd out options. Okay. Before going to the MCQ, first we will see the differences between the fast muscle fiber and the slow muscle fibers. So, skeletal muscle fiber is divided into type 1 and type 2A and type 2B as we see here. Okay. Now, tell me, type 1 is slow fiber or fast fiber? This is slow fiber. This is slow muscle fiber and these are fast. Muscle type 2 are fast fibers. Okay. If I plot a simple muscle twitch for this slow muscle fibers, the graph will be looking like this. Similarly, if I plot a simple muscle twitch for an fast twitch muscles, the simple muscle twitch will be like this. What is the obvious difference you are seeing? The duration of the muscle twitch is high, the duration of the muscle twitch is very less, right? Because here the contraction is taking place very slowly, as well as relaxation is taking place very slowly, but here all the actions are very fast. This slow contraction and slow relaxation are based upon two enzymes, that is myosin ATPase and SERCA. Myosin ATPase and SERCA. If these enzyme activities are low, then my contraction and relaxation will be slow. If these enzymes activities are more, my contraction and relaxation will be very quick in action. If you see roughly the average duration of simple muscle twitch of slow fibers are about 90 milliseconds. This is about only about 7 to 8 milliseconds, roughly about 7 to 8. Okay. Then what other differences you could find this between these two muscle fibers? Slow, I can write it as SO, type 2A fiber as FOG and type 2B as FG. Here F indicates fast, S indicates slow. Here the O indicates oxidative type of metabolism will takes place here. Here glycolytic metabolism will takes place here. Okay. Since it is requiring the metabolism oxidative, we need more amount of oxygen supply, right? If we want to supply more amount of oxygen supply, we should have a high capillary density, because once the capillary density is high, the oxygen delivered to the areas will be high, and since in order to take out this metabolism, oxidative metabolism, we need mitochondria and plus myoglobin. All these are very high in slow muscle fibers. All these are very high in slow muscle fibers, while in 2A and 2B this will be low, and 2B this will be very low. Since which is having a high capillary density, high blood flow, the color of the muscle will be red. The color of the muscle will be red. Here, since involve both oxidative plus glycolytic, the color is also will be red in nature. Here the color will be white. Okay. And finally, since it is having an oxidative type of metabolism, it is involved in the muscle activity for an posture maintenance, which is serves long time action of muscles. So because this is fatigue resistant, this is moderately resistant, and this is easily fatigable, this 2B. Since it is fatigue resistant, this can be used for posture maintenance. Okay. So you have to be very clear between the difference between type slow fibers and type 2A and 2B fast fibers. Okay. Coming to the MCQ. Now tell me the answer for this question. Slow twitch muscle fibers. It has low ATPase activity. Yes, it has low. It is adapted for posture maintenance. Yes, because it is fatigue resistance, it is adapted. Contains more sarcoplasmic reticulum with high glycogen activity. Does it contain high glycogen? No, it has high mitochondria, right? And the type of metabolism does not use glycogen, it uses oxygen. So this only odd out options. So the option for this question is option number 3, and you know that this is resistance to fatigue. Okay. The next MCQ also based upon this differentiation only. This diagram illustrate single isometric twitch characteristics of two skeletal muscles A and B to when depolarizing stimulus. Which of the following best describe muscle B compared to muscle A? Just see the diagram, just see the image and try to find what is given here. This is just now we have seen in the differentiation. Try to find the type A, this muscle is, and type B, which of the muscle is fast and which of the muscle is slow. If you find this, the option is very easy here. Just look for the duration of the simple muscle twitch. This is the simple muscle twitch of muscle B, just see the duration, and just see the duration of muscle A, very short. So this option A, the muscle is fast and the B is slow. Now the question is asking about the muscle B. Now see the answer. It has fewer mitochondria. No, this is slow muscle, right? You need mitochondria rich. So this is not the option. It has less extensive blood supply. No, high capillary density, red muscle fiber. So this also won't be the options. Has low myosin ATPase activity. Yes, because of that only the duration of the simple muscle twitch for the muscle B is prolonged. We have low myosin ATPase as well as low SERCA activity. Okay, this is the option C. Okay, is it ECT fatigable? No, this is our fatigue resistant group of muscles. Yeah, from the muscle this kind of differentiated questions can be asked. Okay. Moving to the next question, just see the option. A man was suffering from dilated cardiomyopathy, a clinical based question, dilated cardiomyopathy. Which of the following protein marked in the sarcomere is responsible for these conditions? Okay, for that you need to find what is the option A, what is the protein what is the option B protein and C protein and D protein. First you have to find this, then only you can able to answer this question. I have image. This is the option A is nothing but our nebulin. This nebulin protein is that it runs along the length of the, what is this filament, actin or myosin? Actin. Runs along the actin and controls the length of the actin muscle, nebulin. Okay, and the B protein given in the question is B cap is that or alpha actinin. Alpha actinin. What is the role of this? This cap Z or alpha actinin binds this actin with the Z line. The function of this cap Z or alpha actinin is bind the actin to the Z line. And the option C given in the question is titin. The titin runs from Z line to the M line, Z line to the M line, and it controls the elasticity. It controls the elasticity of the muscle fiber. The very important protein, and it is the largest protein found in the human body. The main role is to control the elasticity of the muscle fiber. Okay. On option D is your myomycin. What is the role of the myomycin? It just binds the thick filaments with this M line. Okay, there is no much role the myomycin. Now tell me from the functions what we have discussed to the structural proteins. Now tell me what could be the answer for this? Elasticity, just the key word for this. If the elasticity is lost, what will happen? The muscle fibers are getting the loosened structures, right? So the dilated cardiomyopathy, titin protein, if the gene of the get mutated for this titin protein, the person will get the dilated cardiomyopathy conditions. So the options will be the C. The C is nothing but your titin protein. Okay. Then the graph below shows the percentage distribution of the globin chains of various types of hemoglobin. They are asking the alpha chain of hemoglobin is indicated by. Just see the look for the image. The x-axis, the relationship with the age from the embryonic period to the postnatal life, and here in y-axis percentage of globin chain synthesis. In order to answer this question, we need to know what type of hemoglobins are available in embryonic period and what are the chains present in that. Okay. So this is the tabular column given here, and from the during the embryonic period, these are the three hemoglobins present: Gower 1, Gower 2 and Portland. These are the globin chains, you have to be careful. Okay, they are asking this only. So we need to know what type of globin chains are available in hemoglobin in embryonic period, fetal period and adult period. This is hemoglobin F found in the fetus, and hemoglobin A, A2 and very minute amount of F is found in adult hemoglobins. Okay, if you could see this from these chains, you could easily derive that this alpha chain, you could able to see here adult alpha chain, A2 adult alpha, hemoglobin F in fetus we have the alpha, and see the embryonic hemoglobin also we can able to find the alpha. So alpha is the only globin chain which is found all throughout all the periods. Starting from embryonic period, its level keep on increasing and its level persists in the adult life. So the image, the question is about alpha chain only. Just see, it is present in the embryonic life and also in fetal period, and also in the postnatal it continues in the adult life. Okay. What could be this one? Option C. What could be the option C? What is this image graph C indicates? It is present only very minute amount in the embryonic period and the fetus period, but the level increases only after the birth, which is nothing but your adult hemoglobin. The chain is alpha 2 beta 2. This is nothing but your beta, because beta is found only in the adult hemoglobin. So, this is your beta, this is your gamma. Okay. Okay. Clear? This type of questions also you can expect the upcoming NEET 2023. Okay. Question number 9. A 35-year-old woman volunteers for study on respiratory physiology. They are keeping two probes, probe A and probe B. Probe A is placed on parietal pleura, between and visceral pleura. What is the pressure they are measuring? Intrapleural pressure. Intrapleural pressure. Probe B within the cavity of alveoli, what pressure they are measuring? Intra-alveolar pressure they are measuring. Okay. Intra-alveolar pressure they are measuring, and the probe provides an pressure reading related to atmospheric pressure. And which of the following sets of value will mostly describes the end of inspiration? What is the pressure values at the end of inspirations? Okay, we will come to the options. Before that, just see this diagram. And this period will be your inspiration and this is your expirations, and here we are recording two pressures. The first graph indicates the intra-alveolar pressure and the second line indicates the intra-pleural pressure. Okay, just see, this is the start of inspiration, end of inspiration, or start of expiration, end of expiration. They are just asking the end of inspiration, what is the pressure values. Just from the C graph, here intra-alveolar pressure is 0 at the end of inspiration, this will be 0, but when you take the intrapleural pressure during the course of inspiration, the pressure has changed from -4 millimeter of mercury to -6 millimeter of mercury. So, at the end of inspiration it is more negative, the intrapleural pressure will be more negative, right? Okay. So, from this graph we got this answer for this question. The option is D, probe A -6 millimeter of mercury at the intrapleural pressure and probe B at the intra-alveolar pressure at the end inspirations. Okay. Moving to the question number 10. It's a very very big history, but seeing the options we will come to know it's a very easy question. 60-year-old woman, just I am highlighting the very important points in these questions. Okay, 3-month clinical history of shortness of breath, chronic cough, okay, and her symptoms are worsened after light activities, positive history of smoking, and X-ray shows flattening of diaphragm. This is the key feature which help us to understand whether this patient is suffering from obstructive or restrictive lung diseases. The patient is suffering from obstructive lung diseases because the flattening of the diaphragm indicates our lung volume has increased. Okay. Okay. Now they have did the pulmonary function testing, and what is the result of that? Okay. And we know that in obstructive diseases, the problem is to the airflow. There is no much problem to the inflow, air inspiration in an initial period. So, when the person takes air inside, whenever the person tries to expire out, he cannot expire out the whole amount. Some amount of air will be remained in the lung and it keep on accumulated. So, if we take the residual volume, the residual volume will keep on increased in the obstructive type of patients. So, if we measure the total lung capacity for this kind of patient, the total lung capacity also will be increased. So, try to find an answer which is having a total increased lung capacity. It is decreased, so it should not be the option. Increased, it can be the option. Normal can't be. Total lung capacity, no. So, this will be the option. So, try to catch a simple point and try to answer this kind of MCQs very quickly. Okay. Okay, this is very easy. Which of the following depicts the graph of perfusion limited gas? Very easy, this questions. Option A or option B, option C. Sometimes multiple answers also can be correct for this question. This is a multiple answers correct. Okay, so we have a types of gases. One is diffusion limited as well as perfusion limited gas. Okay, perfusion limited gases are nothing but oxygen, nitrous oxide. Diffusion limited gases are carbon monoxide. Okay, here the graph shows that this is the time at the start of capillary and this is the end of capillary, and this is the time at which the blood flows in the lung capillary across the alveolus. Okay, and this is called as transit time. Transit time, the option is 0.5 second. Total transit time is 0.75 second. Perfusion limited gases like oxygen and nitrous oxide, especially oxygen, before the blood reaches to 1/3 of the capillary, the alveolar PO2 and the capillary PO2 gets equilibrated with each other. There is no further increase in PO2 after that period. Remaining the 2/3 of the time, there is no change in the PO2. If I want to change or increase the PO2 for this individual time, only probability is that I have to increase the blood flow. I have to provide more blood in the desired durations. If I give more blood, so more amount of oxygen will be getting delivered to the blood. Okay, so the perfusion limited gases are nothing but oxygen and nitrous oxide. The graphs are, the option B graph is for oxygen and the graph A is nitrous oxide. Okay, so option A and B are correct, and the option C is nothing but diffusion limited gas is nothing but carbon monoxide. Okay, okay, coming to the last question for the today. The primary direct stimulus for excitation of central chemoreceptor regulating ventilation. Here I am going to discuss two words, the primary direct stimulus and the most sensitive stimulus. You have to pay attention to these two words. If they ask the most primary direct stimulus, the answer is increased H plus, which is for this question. If they ask the most sensitive stimulus for central chemoreceptor, the option will be carbon dioxide. Carbon dioxide is the most sensitive stimulus. Please pay attention to these words, keywords. Sensitive stimulus, carbon dioxide. If it is direct stimulus, primary or direct stimulus, increased H plus. Okay. Okay guys, the remaining 13 questions we will discuss on February 23rd. Okay, that on 2 days after. Until then, see you guys. If you have any doubt, you can put in chat box. Okay, thank you guys.